I'm a cardiovisual nurse educator, and today we're being joined by Michelle. Oh, hi, Michelle.
Hey, how are you?
Good. How are you?
Good.
All right. I just want you to introduce yourself to everybody and just kind of let them know everything about you.
Sure. Hi, guys. My name is Michelle Rothenstein. I'm a registered dietitian nutritionist who specializes in heart disease management and prevention through science-based nutrition. I'm excited to be here and chat with you today.
Yeah, thanks so much. So first of all, what kind of patients do you see and deal with?
So I see individuals who are at risk for heart attacks, strokes, who have a heart condition like atrial fibrillation, cardiomyopathies, heart failure, and I see individuals who've had a cardiovascular event from heart attacks, strokes, bypass surgeries, really to prevent the occurrence of another one, but really also to optimize cardiometabolic risk factors so that we can prevent this altogether. A lot of times people come to see me because they have a strong family history of heart disease. They have high lipoprotein A values. So really anything having to do with the heart, that is who I see. And I really have a love and passion for what I do.
Yeah. So how many patients do you really see that have diabetes as well as heart disease?
So many people either have prediabetes, diabetes, or even insulin resistance. And insulin resistance is really prevalent, especially individuals with heart disease. About 70% or more people who have heart disease, have had a cardiovascular event, who have any heart condition are insulin resistant, and that can progress the disease. So diabetes is something that really needs to be taken seriously, and optimizing blood sugar levels, insulin metabolism is a key point of every single client that I touch upon, because we need to make sure that we're not allowing it to become diabetes or prediabetes, and really helping our body with metabolizing the food effectively. I'm a certified diabetes educator, and a lot of people say to me, you specialize in heart disease. Why are you also doing that? And they really go hand in hand. Diabetes increases your risk of heart disease, heart attacks, strokes by twofold. And not only that, it can affect you at a younger age. So the longer you have it and it's not managed or controlled, the more increased and aggressive the heart conditions are. So we want to take this as a preventative measure, and really take an empowered approach of, wow, I do notice that I am insulin resistant, whether that's having stubborn abdominal weight, whether that's having high triglyceride levels, knowing that you have excess skin tags, fatty liver disease. These are all signs that insulin resistance are brewing in your body, and we need to make sure we're tackling it.
Yeah. So how do you classify if somebody's pre-diabetic?
The definition is really at hemoglobin A1C between 5.7 to 6.4%. That's where prediabetes does take place. And so checking your hemoglobin A1C at your annual physical appointment is really important to assess kind of where those trends lie, to make sure that we're looking at it. Many times people confuse, I look at my fasting blood sugar, and that's normal, but that's just looking at one snapshot in time. And we actually want to look at your hemoglobin A1C because it's a 3-month average of your blood sugar levels. So when you're sleeping, when you're eating, based off your cortisol levels, it's really giving us a amount of, in 3 months, how much glucose is in the bloodstream that's attaching to hemoglobin. So it gives us a better indication of your blood sugar control in those 3 months. But just as a caveat, because I'm very big about prevention, insulin resistance, you can have it for decades before that number elevates. And what does that mean? So when you have insulin resistance, your body, your pancreas is overproducing insulin to compensate. And so what happens is your blood sugar levels will be normal, but in the background, your body is overworking. And once it can't do its job anymore, that's when hemoglobin A1C starts creeping up and blood sugar levels start elevating in the body. So we don't want insulin resistance to go untouched. This is applicable to anybody who's trying to protect their heart, protect chronic disease, prevent diabetes. We need to address insulin resistance, which is the root cause of all of these issues in terms of type 2 diabetes and prediabetes as well.
Yeah, that's very important. So, so say somebody just got diagnosed with prediabetes from their primary physician, but they have not talked to a nutritionist at all. What common misconceptions and what do people tend to do that's probably not the best for them to do? I mean, like fasting, you know, all that kind of stuff. What's your opinion and what's your medical experience on that?
Yeah, so I find a lot of people first probably go to Google, like best diet for prediabetes and diabetes, and Google has no credentials and nothing to help, so that's not helpful. I find there's so much to say about this, but I think if I had to categorize what most people do that would be a mistake is one is they will either go low carb and sometimes to the extreme of keto, where they will go so low to go into ketosis. And the issue with this is many things. One is you're going to lower your blood sugar levels because you're not giving your body carbs, so it's not going to overproduce insulin and so forth. However, you are going to increase your LDL cholesterol, you probably will increase your blood pressure levels, and you could still cause inflammation in the body, which we don't want, because you can't just look at one lab by itself. You have to look at how that's going to influence other things. But you're also not teaching your body how to address insulin resistance. You're just removing the problem, kind of putting a Band-Aid on something versus actually addressing the underlying root cause. But not only going low carb or keto is bad from that aspect of heart health, you have to also realize that most people, depending on what you're eating on a keto diet, you're going to have a high level of saturated fat. And saturated fat actually causes our cells to become more insulin resistant because it doesn't allow for insulin to be utilized, especially in the muscles, effectively. So it's super important that we aren't eliminating carbohydrates. We are reducing and avoiding as much as possible those refined carbs, but consuming complex carbs with fiber and in the right balance of protein and heart healthy fats to allow our body to process and learn how to utilize insulin effectively. When we pair all of these things together, we're essentially allowing a slower release of blood sugar to go into the bloodstream. And so our body is able to respond, still produce enough insulin, but in the right dosage to put blood sugar into the cell and not cause all of these issues. The issue with just removing carbs is you're not really addressing the underlying issues. You're removing it as a Band-Aid, and that's gonna be detrimental to your heart health, which is an important component to understand and recognize.
Yeah. So what are some preventative and proactive approaches to nutrition and diabetes that you tend to help tell patients to do?
Yeah, so really focusing on the balance of your plate, focusing on your hunger scale, focusing also on inflammatory foods and blood pressure, because insulin resistance and blood pressure are actually very one and the same, in the sense of high blood pressure can cause insulin resistance, and also the other way around. So really looking at, instead of what are you avoiding, what are you eating in the right quantities to help reach all of your goals. If you are overweight, if you have abdominal adiposity, so if your waist circumference, which is measured by your belly button, is higher than 35 inches in women or above 40 inches in men, we definitely need to address that. Because that's going to be a big component in terms of optimizing your risk profile and addressing all of these things. So we need to be addressing inflammation, oxidative stress, insulin resistance, and focusing on what we're adding to the diet to allow these pathways to work. So for instance, with diabetes, if you don't have enough chromium, your your signals in the cells aren't as sensitive to insulin. So we need to focus on adding more things with chromium, like broccoli and hazelnuts and pears and things like that work for you. So I'm very much focused on what are we adding versus eliminating, because oftentimes people will say, oh, you have diabetes. If you lose weight, your diabetes can go away. But what diet are you following to lose weight is super important for diabetes management and for heart health. So we need to be looking at getting in a well-balanced diet with a lot of micro and macronutrients in the right balance that will help. A lot of times people also will fast for a very prolonged period of time, and that won't allow for your body to metabolize the food as effectively. For example, I have had clients come to me who are only eating in a 3 to 4 hour window. Now, I want you to take a step back and think about what this does. You are starving in that 3 or 4 hour window. You're trying to get all your calories in at that moment. And so you're eating a lot during that window of time. And now you're asking your body to metabolize it. And it simply can't. Your body cannot metabolize a large quantity of food in a short window of time. So what happens? Your blood sugar rises, your blood pressure rises, because your body is trying to actually metabolize all this. And you also maybe feel fatigued, low energy. It could impact your mood. There's so many things that would happen, and it's not sustainable. So if you fast in the way where you're doing intermittent fasting, where your eating window is between 7 a.m. and 7 p.m., fine, that's great. You can get all of the nutrients you need. You can eat it effectively so your body can metabolize it. And you're also shifting caloric intake in the morning hours where your body is better at utilizing insulin. So you will be able to improve your blood sugar levels, and you'll be able to also protect your heart, protect your kidneys, protect your brain. You don't want to just look at one chronic disease prevention in silos. You need to look at the whole picture in order to truly prevent chronic disease.
Yeah. So just with the holidays coming up too, what is some advice for, good foods and how to balance all the sugar and all the things that we like to bake and cook for Thanksgiving and Christmas and all the holidays?
Yeah, so there is actually a syndrome called holiday heart syndrome. And what ends up happening is individuals have too much salt, too much sugar, too much alcohol, and it puts a lot of pressure on the cardiovascular system. So it causes atrial fibrillation. It causes an irregular heartbeat. And so it's important to kind of take a step back and say, let me look at December, at holiday season, and assess kind of what does it look like? Am I going to holiday parties every single night? And what can I do to set boundaries, to nourish yourself, get good sleep, lower your stress levels, and put those boundaries so that you're continuing to be mindful during the holiday season? Because it can kind of be like, oh, I'll just start in January. But a lot of times you'll hear and you'll see all these articles come up about this is a time where heart attacks and strokes happen more often because people aren't being super mindful. So I always say go into the holiday season with a plan. If you know you're going to a holiday party and it's going to have all these foods that might not be the best for you, okay, it's one night and you're making sure that you're still sticking to the right routine and regimen with your exercise, your nutrition, your sleep, your stress surrounding that holiday party. If you make that holiday party or that holiday for the whole month of November, the whole month of December, then it is putting a lot of extra pressure on your heart. But if it's just one meal, and you recuperate the next meal, your body can handle that. But you want to make sure that you're putting in and navigating those steps. And you never want to go to a party starving. It's the same idea of that fact where you're now going to eat a little bit too much. And it's not so much the calories, it's more of just the metabolic load. Your body struggles with processing those foods when you just eat all of it at once.
Right. So what education is out there for patients or healthcare workers regarding, education with nutrition, diabetes, and the heart?
So there are a lot of great websites, like the American Diabetes Association has a lot of great material. I always say, though, you can look through that, look at the plant-based DASH diet, the Mediterranean diet. But from my experience, many people have a hard time applying those principles into their lifestyle. So if you are struggling, you should seek out support from a registered dietitian who can help you plan out your meals, plan out the things that are challenging to help you reach your goals. And that's really helpful in it too. It's also important that you're looking at reputable websites, but you really understand and focus on what are you adding? What are you including in your diet? How do you feel? How are your energy levels? How all of that plays a really big impact in all of this as well.
I think the only questions we had from some of the followers is about intermittent fasting or fasting, if it's okay if they have diabetes. You might already answered that one. And then the effects of the keto diet on diabetes, which you also kind of answered that one as well. Let's see. Is there other misconceptions that you want to go over, or any other issues that you tend to see?
It's really about the whole low carb keto. I think that's a big thing when it comes to that. I also just want to really emphasize also the fact that even if your hemoglobin A1C is like okay, you still want to be mindful of that insulin resistance and really connecting that picture between waist circumference. I think going through the holiday, I guess my last kind of point is, we tend to really focus on a weight, on a number on the scale, but from a cardiometabolic standpoint, where it's located is super, super important. So I encourage everyone and all my clients to really check your waist circumference, get a soft measuring tape, don't suck in, don't suck out, stay in a neutral position and assess where it is. So many people think their pant size is their waist circumference, and that's actually much lower than your waist. You want to check around your belly button. And if you are above 35 inches for a woman, above 40 inches for a male, you really want to address that first, because that's brewing inflammation, insulin resistance, and a lot of pro-inflammatory issues and complications. If you are of certain ethnicities, like if you are South Asian, we actually want those parameters to be about 2 inches lower than the general guideline standard. So super important to assess that. And if your numbers are normal, within normal range, I always encourage every 6 months, year to recheck it, because if you start seeing a trend in the wrong direction, that's where we can be proactive and really target it, because that's going to help reduce the risk of diabetes and cardiovascular disease and a lot of other issues. So many people think of weight when we come around the holiday season, and I want to look at, weight is important from both diabetes prevention, heart disease prevention, but really assessing where it's located is really important. And also avoiding any of those fad diets that make you have, or promises that make you have a lot of weight loss too quick. Because when you have weight loss too quick, you can lose muscle mass, you can also have scarring of the liver, and it could put more pressure on your heart, but it also can cause more rebound weight gain. So super important that we go slow and steady with weight loss in order for your body to do it, to have a sustainable approach, but also for your body to not get those complications from aggressive fast weight loss.
Yeah. Do you feel like social media too can be beneficial, or do you feel like there's some harmful things circulating in social media as well?
Yeah, I mean, a lot of times, I have a 6-week group program, and I have one-on-one programs as well. And every time we're in the 6-week group program, everyone always mentions like, what about this? What about this? And it's all these trends from social media. And I really strive to teach everyone how to be a smart consumer and not let social media, or, if you have a heart condition, you're typing it into Google, you're going to get ads for supplements, and a lot of those supplements can do more harm than good. And so really consulting and getting personalized care from a health professional who has your best interest in heart, but also who understands what you're going through and has the experience and the credentials to be giving you advice is really, really important.
Yeah. Well, do you have anything else to add, or should we wrap up?
Any other questions, I'm happy to answer them. Anything that you'd like me to address, I'm happy to. Otherwise, I hope that this was really helpful for the audience. And yeah. I hope is it going to be just saved so that I can, if anyone came in the middle or wants to watch it later, maybe we can allow for a replay as well.
Absolutely. And I think I did see one question about PCOS and diet. I'm not sure if you have any input on that real quick.
Was there a specific question, or was it just that?
I think it was just related to PCOS and diabetes.
So PCOS,
as far as nutrition.
Yeah, so PCOS can cause insulin resistance. And so we definitely do want to make sure that you're having a well-balanced diet that has the right amount of macronutrients, micronutrients, has variety, and has specific elements that are found in certain foods in your diet to improve both the, the risk factor of diabetes, gestational diabetes, but also to help protect your heart too. We want to make sure we're not doing anything because PCOS also increases your risk of heart disease. So we don't want to go low carb on PCOS. It's really important that we're having that balance. I don't know if there was any specific questions within PCOS diet, but like the general sense, that's kind of what it is. Some people have some dairy or gluten intolerances, but if someone doesn't, then those things should be included in the diet because it does actually help with gaining magnesium, calcium, and a bunch of different types of fibers that are important for heart health too.
Yeah. And that is actually a good question with allergies. I know a lot of people these days have a lot of allergies, and that can be very difficult to have a well-balanced diet in today's world. Do you have any advice for people that have a gluten allergy or an egg allergy or peanut allergy, and how just ways that they are able to address that?
Yeah. If you eliminate a food group or you eliminated a big category of something in your diet, you want to find other foods that can give you those nutrients that are found in those foods. And if you can't, then you want to supplement. And so a lot of times when people are picky eaters or have intolerances or food allergies, it's really helpful to work with a registered dietitian, just because we can come in and say, you know what, you're deficient in vitamin B6, you're deficient in manganese, you're deficient in phosphorus, you're deficient in calcium. And based off of what you do eat, this is what I would add to your diet in order to make sure that your nutrients sufficient. A lot of times I've seen this over and over again with a lot of my heart attack survivors and individuals who have heart failure, who have AFib. A lot of times they're nutrient deficient. They are so focused on what they shouldn't be eating that they have lost focus on all of the things they need to be eating and in the right dosages. And while it would be just great to be like, oh, just eat fruits and vegetables, it's actually not getting in all of the nutrients. And which fruits and vegetables, in what quantity, everything is different based off of the medications you're on, the medical diagnosis you're on. There's so many pieces to the puzzle that we need to piece together. And I wish it was simple, but there is some complexity to a lot of this. And so working with a healthcare professional who can really hone in, especially if you're eliminating a lot of foods or a lot of food groups, can ensure that you're getting the right nutrients in the right dosages.
Yeah, absolutely. Well, if you want to share where people can find you and follow you and your website.
Sure. So I'm heart.health.nutritionist on Instagram, and you can follow me on my website at entirelynourished.com. And in there, you can also sign up to my email list, where I do send a bunch of heart disease prevention tips directly to your inbox as well.
Yeah, well, thank you so much for joining us today. And for Cardiovisual fans, we have a website as well. It's called clinic.cardiovisual.com that we have a lot of educational videos. And I think actually, Michelle, you have a lot of education on there as well. I think in the nutrition portion, you have a couple videos in there. Yep. So follow us and let us know if you guys have any more questions, and we can either do a follow-up or a message back with any answers. So thank you so much for joining us today, and have a great Wednesday.